At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Pain and Pain Management on Wednesday, April 16th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, Dr. Tom here. Welcome to Dr. Tom Roselle Live. Got an interesting program for you. And first, you'll excuse this very low voice that I have. But, this is the first year that springtime allergies got me, and they got me good. I don't know why. I've been told that because I've been traveling too much and not getting enough sleep and, breaking all the rules that I tell you all not to do. That's probably really what it is. And so it got me. I feel good. You just can't hear me too well. But anyway, the information that you're going to get today is going to be really top shelf. And, hopefully I can get rid of this thing and it'll go on. But as long as I'm clear and concise and able, we're going to deliver the program straight up and give you the data that you need to have. What are we talking about? We're going to talk about something called fibromyalgia, and it's kind of a springboard into a program that we're going to do at the Roselle Center for Healing, April the 16th at 6 p.m. And the weather's going to be great, so please join us. So what's the name of the program? What does pain have to do with it? We have all kinds of pain patterns, and they're all differentiating. They're actually telling you something. And when you ignore the pain or you try to dumb it down, you blunt it with medications or whatever it is, you're actually ignoring something that really needs to be paid attention to. If you have, pain in joint spaces, if you have pain throughout your body, if you have muscle cramping, if you have, a sharp shooting pain that happens wherever, you name the place, those areas could be very specific relative to an organ-muscle relationship. It could be very specific relative to, underlying very significant problem that you could be developing. Well, we hate to use that big C word, right? The cancer thing, but you can't ignore things. You can't just dumb it down. You have to understand it. And on the 16th, we're going to do that. We're going to lift the veil on a lot of these things. We're going to talk about this fibromyalgia problem, but we're also going to talk about myofasciitis. We're going to talk about chronic pain syndromes. We're going to talk about wind-up pain, which you're going to hear me talk about later on. It's critical that you act when your body's trying to tell you something is not the way it's supposed to. So mark the calendar, the 16th, if you will, of April at 6 p.m. at the Roselle Center for Healing in Fairfax. Join us. And you can register right now. You go to drtomroselle.com and register, or call the office, 703-698-7117. That's 703-698-7117, and tell them that you'd like to be there. And the only thing we ask from you is simply this: if you know you can't make it, something comes up, just let us know so we can have the space for someone else. And because, as you know, more often than not, we have to say, I'm sorry, we don't have the room that we'd like to. But here's the deal. Let's get into fibromyalgia a little bit. There's somewhere between 10 to 12 million people in the United States that are very specifically diagnosed with fibromyalgia. Now, we got to dissect that word. Fibro means connective tissue. Myalgia means muscle. It's not the joint space. It's not the organ systems. It's the connective tissue that surrounds a lot of different things, the muscles and so forth. So fibrous connective tissue. So when you look at the real estimates of this thing, somewhere it's estimated between 6 to 7% of the world population. That's a whole lot of people. And unfortunately, ladies, you are the ones that are most challenged by this situation. And, up until recently, now they're starting to take a look at it, why that might be. But 75, some authors will say up to 90% of the people with fibromyalgia are women. Is that because you're the weaker the sex? No, it's not because of that. It's because you are genetically built with more estrogenics and you have other things that make you female that seems to be receptive to these things. The diagnosis is usually made with people somewhere early on, maybe 20, 21, 22 years old, up to about 50. But you get it also all the way up to about age 80, and approximately 8% of adults meet the American College of Rheumatology's definition of fibromyalgia. We're going to talk about a little bit about that. But here's the deal, and this is what you have to really understand. When we're dealing with a patient who's in pain, it's critical, it's absolutely critical to understand what the triggers are, where they're coming from, and why they're there. And if you don't, you're going to not only misdiagnose, but you're going to mistreat, and you can actually make things far worse than they would be otherwise. The American College of Rheumatology came up with a criteria for fibromyalgia about 1978, if I remember. Excuse me. And what they found was that you had to have these trigger points, and these trigger points were very, very susceptible to pressure. And there's like 18 of them in the body, but you had to have at least 11. And if you put 4 pounds of pressure, how much is that? That's so much pressure that if you put your finger on your eyeball before you said, stop already, it's killing me. 4 pounds of pressure, and it would elicit these pain patterns. Some of them would refer, and some of them would just be painful there. Now, remember we said fibrous connective tissue, and that's people, or things in the body that make people hurt, if you will, everywhere. Now, here's the other piece of the condition. You have to have pain throughout your entire body all at one time. Number two, you have to sustain that pain for at least 4 months without it being modified. That's a big deal, right? Now, if you have pain in your upper body, and your arms hurt, and your hands hurt, that's significant pain. We don't want you there, but it's not fibromyalgia. If you have pain down your left leg and it just never goes away no matter what happens, that's bad pain, and that needs to be treated properly. But guess what? That's not fibromyalgia. So you have to determine what it is. Now, there's a lot of guys out there that are treating the pain of fibromyalgia with neurogenics, things that affect brain, and dumbing down the expression, the perception, if you will, of the pain threshold. And we're not going to get into that because I disagree with it completely. There's other ways of doing that. Now, why would you be more susceptible, ladies, to fibromyalgia than a guy would? Well, there's this thing called estrogen and progesterone imbalances. So if that's the truth, then we have to look at several things. We have to look at your fight-flight system, which is your adrenal system, and the production of estrogens, progesterones, and testosterones. We have to look at ovarian function. We have to look at the communication between the pituitary and those areas, because that's the triggering mechanism for all those things. But here's the deal. With fibromyalgia, there is no swelling. Swelling does not exist as part of the threshold. You can have concomitant situations. You could have swelling, but it has nothing to do with the fibromyalgia. It's something else that is secondary to that. So when you understand that there are overlapping pieces, you have to start going through the weeds and figure out why does it affect what and so forth. And I'm going to get into that. Dr. Stephanie Pina and I will be co-hosting and co-teaching. And those of you know Dr. Pina, she's a wealth of knowledge. She's amazing. She's a doctor of naturopathic medicine. So we're going to look at it from a multidimensional platform. Let me give you the 7 different identifying pieces of fibromyalgia pain according to some people. I think I could add several more, and I probably will, not necessarily today. But we talk about myofascial pain. They're talking about tight muscles. Well, there's an argument that says those tight muscles really aren't causing pain, but they're misfiring. They're locked, they're not letting go. And that's not necessarily a spasm muscle. That's just a muscle that's not communicating properly. There's central sensitization, and that means that there's brain pain. And they're treating a lot of fibro patients as if it was coming from the brain and the brain only. Not the case. And then you have neuropathic pain, which is pain that is being triggered by the nervous system. Yes, that's probably involved, but the answer is why. And then you have pelvic pain syndromes. Ladies, unfortunately, that's when you have intercourse and you hurt, and it's really not fun. Migraines and headaches, maybe, and certain kinds of abdominal pain, maybe. But all of those are referred pain patterns. They're not necessarily the primary threshold of fibromyalgia situations. And that's what you have to really understand. In a fibromyalgia patient, the central portion of the brain, if you will, from the center of the brain, that controls things like, your memory pattern, your ability to be calm and collected. Instead, you end up with anxiety and depression and sleep disorders and so forth. But the bottom line is, what is causing that? We know that misalignment of the structural system, particularly the upper portion of the neck, due to trauma, head positions. You could have bumped your head. You could always be in one position. How about your cell phones and your computers? Your head's down all the time. We're seeing more and more things trigger that, where you have pain in the back of the head. Those are structural and spinal disrelationships. Your eyes and your vision can be affected again. But what we've seen over 4 decades of treating patients is that that's usually structural, is usually neural from the upper portions of the brain, the spinal cord, as it exits the skull and goes down throughout the system. So a lot of these other symptoms, if you will, the skin irritation, the pain in the chest, the nausea that you have, the urinary problems that show up, the difficulty in intercourse, by the way, it's called dyspareunia, muscular irritation, twitching. Those are not primary fibromyalgia symptoms. They're symptoms of secondary manifestations that things have been there for a long period of time. We know when there's pain, the fight-flight system kicks in, and that's your adrenal system. Now you have an outer shell and you have an inner shell of that adrenal system, and they do different things. The inner shell controls your blood pressure, controls heart rate, controls adrenaline and epinephrine and so forth, all these things that are balancing acts that communicate in different places. You have an upregulatory pathway. There was an article that I read the other day that said that anybody that has fibromyalgia is going to have thyroid problems. Well, let's back that off a little bit and take a look. Remember, I just said your fight-flight system? Let me tell you what that means. That means that the inside of your adrenal system needs a certain amino acid and neurotransmitter. It's called tyrosine. And guess who else needs tyrosine? It's your thyroid. And guess who's going to get the tyrosine first? Your adrenal system, your fight-flight system, because it has to keep you alive. So you end up with a secondary manifestation of a thyroid problem. So do you see how the interconnected pieces there? But you still have to understand what it is. Years ago, many of you know, and I say every time I talk about the subject, that I wrote a very in-depth paper on fibromyalgia, and it was called Fibromyalgia, the Undisease. And the reason I wrote it and I coined it that was that even today, fibromyalgia is diagnosed when they can't figure out what else it is. So they rule everything else out and say, well, it must be fibromyalgia. And, it meets the criteria. You've had pain for 3-4 months. It doesn't go away. It affects all 4 quadrants of the body. Things of that nature are finger pointing to the fibromyalgia pathway. And then you have all these trigger points that show up, right? They have to be there. And they're in the back of your pelvis, they're inside your knees, they're at the top of your chest, they're behind the head, they're at the shoulder levels, they're at the elbows, and so forth. And when that fibrous connective tissue is being irritated, those pain patterns, those trigger points, those areas that you put 4 pounds of pressure on begin to show up, and they get your attention very, very rapidly, very quickly. So if that's the case, you know, uh, is just having low back pain, fibromyalgia, low back pain that doesn't go away? No, it's not that. It's you remember we said you had to have 4 quadrants that makes it up. How about if you have just pain at the front of your hip and it's bothering you in the back of your pelvis and that's bothering you? It just never seems to go away. Is that fibromyalgia? No, it's not fibromyalgia. What happens if you have those pain, you have depression? No, it's not fibromyalgia. You have to have all 4 quadrants, your upper body and your lower body, involved for over a period of time where the pain doesn't go away. Now, the secondary symptoms of depression, anxiety, confusion, mental slowness, and the list goes on, then you have perhaps a whole bailiwick, if you will, of all kinds of things that now they're trying to diagnose primarily as fibromyalgia. You can have jaw pain. Your mouth can hurt all the time, but by itself, it's not fibromyalgia. You can have sleep issues. You can't sleep. Why would that happen? Why would sleep be involved? Well, if you're hurting, you're not sleeping, right? That's number one. Number two, it's upsetting all your neurotransmitters, the things that keep you to sleep. And in the initial stages, what happens is your fight-flight system increases the production of something called cortisol. If cortisol is too high in the middle of the night, you're wide awake and bushy-tailed. You're not going to sleep. I promise you that. When you have that constant thought process going on in your mind, well, guess what? Your cortisol has kicked in, so you can sit there and you can focus. And then the depression and the anxiety, yep, because what happens? Dopamine and serotonin are altered. And those are your relaxation and feel-good things. If you look at people on a neurotransmitter basis, there's something called GABA that is also not adequate. GABA is it calms the body down. It gets, that mind, in a calmer place. We give it to kids who are over the top in ADD. Had they done my GABA threshold when I was young, I'd probably have no GABA, if you will, because I was a constant, ongoing, never stopping type of crazy person. But there's a side effect to that as well. Any of your autoimmune conditions have very specific characteristics, and they try to correlate, well, this may have been this and this may have been that. But again, remember the characteristics, that you don't have swelling with any of these things. Doesn't exist. And if you do have swelling, you have pain, but it could be something else. The pain's widespread. The joints and muscles can be very tight, but it's not because there's damage to the joint at that point. It's because the connective tissue, the fibrous connective tissue, is being irritated and being hampered. Headaches can come about as a result, but it's coincidental with it. It's another symptom of, but it's not demonstrative and diagnostic of fibromyalgia. Tingling and numbness in the hands and feet. Yes, it can be associated with that, but it also can be associated with central cord pain due to postural imbalances and off-centering of the vertebrae that can cause that, which we see a lot of in fibromyalgia patients. Why? Because they hurt themselves. They're not in shape. Their body begins to adapt. How many people do you see that are rounded shoulders, that their slope is forward, and they lock their head backwards? A lot of pain thresholds show up because of that postural pattern, and we set it up ourselves. And then given today's world and the things that we eat and we don't eat, got a problem. But when in today's presentation, we're going and we're looking, if you will, and I mean today's presentation, not here on the radio, but I'm talking about people presenting in a certain pattern. We're seeing tremendous amount of shifting, if you will, in hormonal patterns. across the board, not only in women, but in men. And we're starting to see more and more pain thresholds in guys that you wouldn't suspect them to be there because there's no history of injury and so forth. But based on the chemistries that we're putting in our system from our diets, from what we're breathing in and so forth, there's a lot of triggers out there that make things much worse. So when we treat a fibromyalgia patient in, I'll say, by the right way of treating it, we're going to look at the underlying balance of neurotransmitters. We're going to look at the position of the spinal system. We're going to be looking at any of the sensitivity mechanisms that are there that have been overlooked. We're going to look at viral patterns as well in today's world because we're seeing more and more of those types of issues, unfortunately, and because of some of the onslaught that we went through over the last several years. Now, what we have to really get, there's factual information and there are pieces that are exaggerated or not even looked at. But in the widespread pain, you can't sleep, and we just talked about that. That could be your cortisol. That's just the fact that you're in pain. You can't think the way you're supposed to. Again, it disrupts the neurotransmitter balance within the body. The pathogenesis, if you will, what's causing it, the triggering mechanisms, if you will, are the things that is not understood by the traditional medical community. So what are they doing? They're sending you to the psychiatrist, psychiatry and neurology, and they're giving you drugs not to fix it because they don't understand the why behind it, but to dumb down the problem. We're coming up to that time of the program when I've got to say, follow me on live stream right now. Go to drtomroselle.com and we'll continue the conversation. We're going to kind of take it a little different process, and you're going to have to put up with the old gravel-gertie voice here for today. I promise I'm going to get rid of it as quickly as I can. But remember, we're here every Sunday, give you the information that you deserve. 16th, don't forget, April, and I'm here one reason only. I love you all. You have a great Sunday. Bye now.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint.
Neuromuscular dentistry is more than just teeth and gums. Neuromuscular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live. If you're in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Pain and Pain Management on Wednesday, April 16th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.